equity in healthcare, which, like so many of the other issues we are facing, should be something we are all striving for. But the reality is that race, gender, geography, socioeconomic status often plays a role in dictating the quality of the care that people receive. This leads to an increasing in disease, disability, and even death in certain populations that would otherwise be prevented.
As a result of a personal tragedy, Andrew Ddembe was motivated to take matters into his own hands. He founded Mobile Clinic to give low-income and rural communities in Uganda access to doctors, treatment, and vaccines that were not previously available. And now, through innovation and technology, Andrew is charting a new course for equitable healthcare for Africa and the world. Let's hear his story.
My name is Andrew Ddembe. I'm a digital health enthusiast. 8 out of every 10 Ugandans live in rural areas. I believe in using health technology to improve last-mile health delivery. About 10 years ago, I had my grandmother suffering a stroke. The people who ran to her, none of them was skilled, the basic first aid skill. There was a lot of delay in also access to care. A few days later, we lost her. It opened my eyes to think about the people who live in these rural areas, just like my grandmother did. I had the idea for close to a year, but I never thought I was the right person to do it. So I had a bit of self-doubt. But then came an ideas contest globally. It was the best idea in Africa, and it made it on the global stage. So after that validation, I said, okay, I think there is more than meets the eye. We're going to go home and do it. What our tool does, it improves on the efficiency and effectiveness of community health workers. If a community health worker is working on a patient and they get stranded, they can utilize our digital tool to interface with senior doctors, with senior medics. We believe that no matter the few doctors we have in Africa, in Uganda, if we utilize our model, we can enable health equity. This is noble work that really has to keep going and to keep growing. The right to health is the same as the right to life.
Please join me in congratulating the 2024 Global Citizen Prize recipient, Andrew Ddembe.
Thank you so much. Coming from a rural area called Buyikwe in Uganda, I never imagined that I would be before you today. I thank God for this honor and motivation that you have given me. I strongly believe that to many youthful change makers and advocates, this is a symbol of possibility for them. I encourage us all to keep striving for a fairer and equal world, to reinvent our health systems and solve the challenge of having half of the world struggling with accessing basic health services. We do not need to wait for another pandemic to land. Tonight, I feel more optimistic and energized that the work we do at Mobile Clinic will enable millions of people in Africa to access healthcare and vaccines in a timely manner, no matter their socioeconomic status or location. I thank the Global Citizen team for finding me worthy of this award. I also thank my team in Uganda and Kenya. I also extend my gratitude to our wonderful board of directors and advisors, our well-wishers, such as my wonderful cousin here, Helen Nachintu, and the husband, Jeff, who are here today. Thank you so much, and I wish you all the best. Thank you.